The following portion of Acadiana Live is sponsored by Lafayette Pediatric Dentistry.
Welcome back. We are hanging out at Lafayette Pediatric Dentistry with Dr. Gorey.
Hi.
Thanks for letting us come visit you today.
Thanks for having us.
Of course. Okay, so we're learning a little bit more about tongue ties.
Yep.
I'm sure you guys see this a lot in your line of work. Is it something to be concerned with?
Yes and no.
Okay.
A lot of times tongue ties do cause problems. They impact your speech, your feeding, different things, even your sleep. But plenty of people have tongue ties and they don't have any functional impact. The important thing is to get it assessed by somebody who's properly trained to see if it's making an impact.
Okay, and is the sooner the better in this type of situation?
Very good question. The sooner the better, yes. Because if it is causing problems, the older you get, the more complex all those problems become and more involved as far as getting therapies to address certain things before the tongue tie can be released.
Yeah.
So yes, earlier the better, even in the newborn stage.
And what are the solutions to tongue ties?
So a lot of times we work with, for example, if your tongue-tied child is a baby, we work with feeding therapists and lactation consultants first to see if we can resolve the issues that way, if it's just about the latch or position, things like that. And if not, they'll refer to me and then we take a look, and if we see that the tongue tie is causing a problem, we do a quick, simple laser release. Very gentle on the tissues. We don't have to cut or anything like that. Cauterizes as it goes. We numb first and everything like that. It's a very quick procedure.
It's quick, and is recovery time fairly simple for the child?
Pretty simple, yes. First couple of days here and there, some minor soreness, and there's some exercises you have to do afterwards, but for the most part, it's pretty straightforward.
And you mentioned you work with some therapists and speech. Why is that so important for you guys?
So I always like to liken it to having a knee surgery. Even if you know for sure you need the knee surgery, you want all the muscles surrounding that joint to be as strong and as healthy and as mobile as possible prior to the surgery. And then afterwards, of course, you need rehab. Same thing with the tongue. It's one of the most important muscles in our body. And if it's limited in use, you're using your tongue as early as 20 weeks in utero, improper motor patterns begin to develop already. And the therapy, both before and after the release, really yields an optimal result. Same kind of thing.
Yeah, so if there's a parent at home that's watching this and they think that their child might have a tongue tie, what should they do? Should they come see you guys? Absolutely.
We're trained, specifically trained beyond our typical dental school training to diagnose and treat tongue ties here in this office. It's an extra thing. So it's always worth just getting a functional assessment because, as I said before, not all tongue ties are problematic. We do not release them all. We also look at other treatment modalities to see if that helps solve the problem first. Other times it's pretty straightforward. Yes, this tongue tie is a problem when we know, but it's always good to get that functional assessment first, like a consultation.
I'm so glad we talked about this today. This is great information for our friends at home. How can they contact you guys?
Our number, 337-443-9944. Just give us a call. Also, there's a lot of information on our website, LafayettePediatricDentistry.com.
Dr. Gorey, thank you so much.
Thank you so much for having me.
Of course.
Appreciate it.
If you're at home, if you want to learn more, go to our website, calebwyatt.com. We're going to put everything you need right there. We'll be right back after this.